Most men believe that if something doesn't hurt in the moment, it's harmless. But some of the most serious complications related to sexual activity appear weeks later, not during the act itself. And many men only realize the connection after the damage has already begun affecting other areas of their health. Certain tissues in the body were designed for elimination, not repeated mechanical stress, and the body doesn't always send a clear warning when something begins to go wrong. Hello, I'm Dr. Ananya Rao. I work with men's health and urology, and here on this channel I explain medical topics in a clear and practical way, so you can better understand your own body and health. Today, I want to help you understand the specific medical vulnerabilities the male body may face during anal penetration, why these risks are often invisible at first, and what delayed complications can sometimes indicate. The rectum and anus are part of the digestive system. Their primary function is elimination, not penetration. The tissue lining the rectum is extremely thin, often only a single cell layer in many areas, and it does not produce natural lubrication. It is designed to move material outward, not to tolerate friction or pressure from the outside. Unlike vaginal tissue, which has multiple protective layers and natural moisture, rectal tissue can tear easily. These tears are often microscopic, meaning you may not feel pain or see blood, but they can create pathways that allow bacteria to move into surrounding tissues or, in some cases, into the bloodstream. The body also adapts quietly. With repeated exposure, sphincter muscles may gradually weaken, tissue can scar, and the local immune response may become less effective. Because this happens slowly, many men do not connect digestive changes, urinary discomfort, or ongoing fatigue to sexual activity that occurred weeks or even months earlier. This is why some complications remain unrecognized until they become chronic. One important risk involves bacterial exposure and infection. The rectum contains a high concentration of bacteria, including organisms like E. coli, which normally remain contained within the digestive tract. When microscopic tears occur, these bacteria may enter surrounding tissues and trigger inflammation or infection. In men over 40, immune responses can be slower, making it harder for the body to clear infections quickly. In India, where stress, irregular sleep, and dietary patterns can already challenge immune function, this risk may be higher. Instead of obvious symptoms like fever, some men experience vague signs such as low energy, body aches, or a general sense of not feeling well that does not fully resolve. In certain cases, bacteria may reach the prostate gland, contributing to chronic prostatitis. This condition can be difficult to treat and may lead to long-term pelvic pain, urinary symptoms, and changes in sexual function. Many men undergo months of treatment without ever understanding how the inflammation began. Another potential issue involves damage to the anal sphincter. This muscle is designed to stay closed and open only during bowel movements. Repeated stretching can gradually reduce its ability to return to normal tone. Small muscle fiber injuries may accumulate over time, leading to scarring and reduced elasticity. In some men, this can result in difficulty controlling gas or stool. Because this develops slowly, it is often attributed to aging or diet, rather than structural change. Once sphincter tone is significantly reduced, recovery can be difficult without medical or surgical intervention, which may affect daily confidence and routine. Hemorrhoids are another concern. Many men in their 40s and 50s already have internal hemorrhoids due to sedentary work, straining, or low fiber intake. Increased pressure in the rectal area can worsen these hemorrhoids, leading to repeated irritation or bleeding. Chronic bleeding, even when mild, may contribute to anemia over time. This can cause fatigue, dizziness, reduced concentration, and lower stamina. Because the bleeding may seem minor, men often overlook its impact on overall health until symptoms accumulate. There is also the issue of sexually transmitted infections. Rectal tissue is highly absorbent, which allows certain pathogens to enter the body more easily. Infections such as gonorrhea, chlamydia, syphilis, or HIV may be transmitted through this route. Symptoms can be mild or mistaken for digestive issues, leading to delayed testing and treatment. In India, social stigma around sexual health often contributes to men postponing medical care. Untreated infections can lead to chronic inflammation, abscess formation, or fistulas, which are abnormal connections between tissues that often require surgical management. The proximity of the prostate to the rectal wall is another factor many men are unaware of. Pressure or repeated irritation in this area may contribute to chronic pelvic pain or prostate-related inflammation. Symptoms can include difficulty urinating, reduced urinary flow, discomfort during ejaculation, or frequent nighttime urination. Because these signs overlap with other common conditions, the underlying cause is often missed, allowing inflammation to persist for years. Understanding these risks does not mean that harm is inevitable, and it does not mean that one experience automatically leads to complications. Every body responds differently. Factors such as age, immune health, overall fitness, and whether protective measures were used all play a role. What matters most is awareness. Many complications develop because men are unaware of these vulnerabilities and do not recognize early signs when they appear. This information is educational and not a diagnosis. Symptoms can have multiple causes and should always be evaluated by a qualified healthcare provider. If you experience rectal pain, bleeding, changes in bowel control, urinary discomfort, or persistent fatigue, speaking with a urologist or gastroenterologist is an important step in protecting your health. Seeking medical advice is a sign of responsibility, not weakness. So here's a question to leave you with. How often do we connect symptoms that seem unrelated to something that happened weeks or months earlier? If this explanation gave you a new perspective, feel free to share your thoughts in the comments. And if you found this helpful, consider subscribing. In the next video, I'll explain how chronic low-grade inflammation in the pelvic region from different sources may gradually affect testosterone levels, energy, and sexual function over time. It's a connection many men never consider until the effects become impossible to ignore.